going on?
How you doing today, sir?
All right, no complaints. How about yourself?
I'm doing pretty good. My
Good.
name is Claude, and I'm going to be a nurse today.
Okay.
And what we're going to be doing today is a head to toe assessment. And, it shouldn't take that long. What we're going to do is do it to give us a baseline of your overall health.
Okay.
Concerning. So what I'm going to do is I'm going to close the curtain for privacy, and get washed up, and then we'll get started. Okay?
Cool.
So I will go and get washed up, but that was demonstrated in the other video that I've done earlier in the previous video, me washing the hands and the hand washing technique. So I'm washing up, and I'll be coming back. Okay. Well, hello again. I'm done washed up and everything. First, what I want to do is I want you to give me your name and your date of birth.
Okay, my name is Corey Michael, and I was born March 10th, 1986.
Okay, and just for verification purposes, let me just look at your wristband and make sure you are who you say you are.
Okay, cool.
All right. So that's checked out. So now what we're going to do is we're going to just get started with the overall assessment.
Okay.
All right. And before we get started, I want to ask you: are you comfortable right now? Are you okay?
No, pretty good.
Are you in any pain at all?
No pain.
Okay. So now, just some sample questions out there to help me start the assessment. Do you know where you are right now?
Yes, I'm in the hospital.
Okay. Do you know what day of the week it is?
I believe it's Tuesday.
You believe it's Tuesday?
Yes.
I'm pretty sure it's Tuesday.
Okay.
And what month is it right
October.
now? October. Okay, and the reason I'm doing this is to ensure that the patient is alert and oriented ×3. Okay? Now, what would you have me address you as in this? Why are we doing this?
Corey? Corey's fine.
Corey's fine? Okay, Corey. So, Corey, what I'm going to get you to do first is get you to stand up.
Okay.
Real quick. And this is going to begin my initial assessment. So, what I'm looking at it, his skin is intact, his hair, he's not disheveled looking, clean shaven, little beard, and his posture is erect and straight. And then from the responses that I got from, who you are, where you are, his speech is appropriate and is clear. So those all need to be documented in the nurse's forms. Okay? So what we're going to do now is, first we're going to start out with range of motion of the assessment of your extremities.
Okay.
And everything. So what I want you to do is, I want you to put your hands, your arms up in the air like this. Alright? What I'm going to do is, I'm going to pull down, and I want you to resist.
Okay.
Okay? See? I'm going to push up, and I want you to resist. Good, good, good. Now I want you to do your arms like this. Alright? I'm going to pull on your arms, and I want you to resist, okay?
Okay.
Good. Alright, I'm going to push, and I want you to resist.
Okay.
Okay? So right now what I'm doing is I'm checking the strength in his upper extremities. Okay? Now what I want you to do is I want you to take your right arm and touch your left shoulder. Okay? Now can you, with that same arm, touch the middle of your back? Okay? Lower back. Okay? Bring it out, wiggle your hand, wiggle your fingers. Okay? Now let's do it with the other arm. Okay? Get back. Okay? Lower back. Okay? Wiggle your fingers. Okay, so what I'm doing with this is I'm checking his range of motion in his upper extremities. Alright, now what I want you to do, step over here to the side for me, Corey. Alright, what I want you to do is I want you to raise your left knee up to your chest. Okay? Put it down. Right knee up to your chest. Alright, you can put it down. Okay, can you stand on your tippy toes for me? Okay, so right now what I'm doing is I'm also assessing the strength of his lower extremities and possible range of motion. Okay, let me get you to make small circles with your right. Okay, do it with your left. Okay, so also I'm documenting full range of motion in lower extremities thus far. Now what I want to get you to do is, I'm going to move this. You can take the slides off for me. Okay. Now, what I want you to do is walk this way. Just walk a few steps, 5 steps this way. And I'm checking for balance, a balanced gait, smooth, Okay, come back, and that's what he's demonstrating in that. Okay, now what I want you to do is the same way you walk down, I want you to actually walk on your heels that way. All right, good job. And again, I'm checking for strength in his lower extremities, which is he seemed to be exhibiting. Okay, you can stop there. All right. Now, what I want you to do is just come over here by me. Okay, now that we're done with the range of motion, I'm going to test your actual balance. Okay. All right. So let me get you to close your eyes. All right. And what I'm going to do is, okay, patient remain balanced, and what we call it is a Romberg test. We're testing his balance, limited swing, so patient exhibiting good balance during this aspect of the assessment. Okay, so Corey, go ahead and have a seat for me. Okay, now what I want to do is, what I'm going to do is I'm going to start with your head and then just work my way down to the rest of the portions of your body. Okay. All right. So first, again, initial assessment. I'm looking at skin, making sure skin is intact. I'm going to palpate his head, okay, and regions of his neck, and check to see if any lymph nodes or anything like that is anything sore up in here, anything tender, hurting. Okay, temperature seems to be intact. So what I'm going to do now is I'm going to be checking the facial muscles and the functioning of the muscles in the face. Okay, so what I want you to do is I want you to smile for me. Give me a big smile. Big smile. Yeah, everything is equal and symmetric. Okay, give me a frown. Okay, good job. Now clench down on your teeth for me, like. Okay. Everything's symmetric. Seems to be working well. All right. Now what I'm going to do is I'm going to take my pen light and I'm going to touch certain areas of your face. Okay. Okay. And I want you to tell me yes, no, when you can feel you're touching them. Okay. All right. So close your eyes for me. Okay.
Yes. 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 Yes.
Okay, you can open your eyes now. And that basically, what that's doing is actually assessing the patient's feeling sensations in his face to make sure that, those cranial nerves and everything are working properly, as well as the muscle. Okay, the muscles in his face. All right. So what I'm going to do now, Corey, is I'm going to actually check your pupils. Okay. So what I want you to do, I'm going to look into your eyes, and upon initial assessment, I'm looking at his eyes now. The whitings in his eyes are clear and white. There's no discharge. So now I'm just going to check your pupils. So what I need you to do is I need you to look straight behind me. Okay, find a spot and focus on it. And I'm just going to look at your pupils. Okay. Good. Good. Good job. All right. So I want you to stare at this top of the pen light, and with your eyes, I want you to follow, okay? Good job, good job. Okay, and with that, the pupils dilate around about 3 millimeters. Okay, the pupils are equal, they're round, and they are resistant to light and accommodating. Okay? So everything looks fine in his eyes. So now I'm going to just look into his nose. Alright? So look in here. Look in here. Okay? On the looks of it, nose is patent, no deviations. Let me get you to close one nostril. Stiff up. Okay? Another one. Okay, good job, good job. All right, now what I'm going to do is I'm going to ask you to look into his ears. Okay, so let me just look into your ears. Okay, they seem to be clear. Okay, Other ear. Good job. No excess cerumen in his ears, no buildup of earwax. Okay. So now what I need to do is look at me. Alright, I want you to close your eyes. What I'm going to do is tell me if you, and raise your hand to the side you hear the sound on, okay? Alright? Close your eyes. What side do you hear it on? Okay? What side do you hear it on?
Right.
Okay? Now, keep your eyes closed. I'm going to whisper something in your ear, and you just repeat back to me what I said, okay?
ABC.
Okay?
1, 2, 3.
Okay, you can open your eyes now. So that was just a test. I'm kind of checking your hearing, making sure that you can hear from both sides. And from what I hear, ear functioning is normal, and he can hear. He passed the whisper test. So we're just going to continue to move down. Now I'm just going to check out his neck, and what I'm going to do now is I'm going to check it. It looks symmetrical. No deviations there, and I'm going to check your carotid arteries. Okay. All right. Strong beats. Pulse. Okay. Very strong. BJ's pulse is going to be about a 3+. Okay, so that's what we want to document. Okay. So now, after we check carotids, I'm going to now check your heart. So I'm going to listen to your heart. Okay. Make sure everything sounds like it's supposed to sound. Clear. S1, S2 sounds, okay? Alright? So, the first spot that I'm going to be listening to is going to be on the right of the sternum at the second intercostal space, and it's actually going to be the aortic. Okay? Okay, now I'm going to move on to the left of the sternum, still on the second intercostal space, and I'm going to be listening to the pulmonic. Good job. And then I'll be moving down to the third intercostal space, which is going to be Erb's point. Slightly right, slightly left of the sternum. Good job. Okay. Now I'm going to move down to the fifth intercostal space, slightly to the left of the sternum, and this is going to be the transcuspid that I'm going to be listening to. Good job. Now last one, I'm going to be moving down to the mid-clavicular line, and I'm going to be listening to the mitral valve, which is right below the nipple. Good job. Good job. Clear S1, S2 sounds, the love dub sounds, areas of listening. So now what I'm going to do is I'm going to inspect his thorax. Right now I'm going to move down and I'm going to listen to his lungs eventually. So upon inspection, I see that the thorax is in fact equal of size, no barrel chested or anything like that. And the AP to lateral is actually intact, and it's going to be AP lateral 1 to 2. Okay? Alright. Excuse me, AP lateral 2 to 1. Sorry. Alright, so now what we're going to do is I'm going to listen to several parts on your chest here for your lungs. Every time I move to a different spot, you're going to take a deep breath for me, okay? And in this, what I'm going to do is you're going to move to both sides. You're going to do to the left, and you're going to move over to the right. 6 spots in the front, 6 spots in the back, and then the 2 auxiliary areas. Alright? Okay? Big breath. Okay? Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay? You should lift this arm up for me. Okay? Deep breath. Deep breath. Yeah. Okay. Other side. Deep breath. Deep breath. Good job. Now, you should lean up a little bit. I'm going to check the areas in his back. Okay? Deep breath. Okay. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. Lungs appear to be clear in all fields. No wheezing, none things of that sort. So they're checked out fine. Now what I'm going to do is I'm going to have Corey bend over just a little bit, and I'm going to check the alignment of his spine. Which everything seems to be in line and adequate. So that's where we are. So at this point in time, I'm going to have the patient actually get up and move over to the bed and lie down so that so I can listen to some other sounds and listen to your abdomen palpate. Okay, so that's the part. Let's do pause. Okay. Okay, so what we're gonna do is let me just look in your mouth really quick. Open it up real wide. Look, say ah. Okay, oral mucosa is moist. Okay, teeth are in good repair. Check this out right there. Okay, so now what I'm going to have you to do is I'm going to have you lie down. And what I'm going to do is listen to the sounds in your abdomen. Okay?
Right.
Okay? Now upon initial assessment, abdomen is straight, it's flat. Okay? So now what I'm going to do is I'm going to listen to the 4 quads of the abdomen, starting with the lower right, which is usually the most active. Okay? See? Okay. Upon listening to the abdomen, the sounds are active, but nothing out of the normal. Okay, now what am I going to do is I'm going to just palpate your abdomen in those regions, and you let me know if there's any tenderness or any pain in when I do that, okay? Mm. All right? Any pain?
No.
Tenderness?
No.
Pain?
No.
Tenderness?
No.
Right here? Pain? Tenderness?
No.
Okay. Right here?
No.
Okay. Upon palpating, the abdomen is soft like it should be. There are no areas of hardness or tenderness in this portion of the assessment. Now what am I going to, now what I'm going to do is I'm going to actually palpate and feel all of your extremities to make sure that they're equal, they're in line. And you let me know if there's any pain or tenderness in those regions, okay? Start with the arms. Okay, any pain?
No.
Tenderness?
No.
I'm also the dorsal side of the hand checking the temperature. Seems to be adequate. Any pain?
No.
Tenderness? Pain? Okay. Extremity seem to be equal. Okay. Any pain?
No, no.
Tenderness?
No.
Pain? Tenderness? Again, checking. Make sure. Temperature. Make sure any pain. Tenderness. Okay. Let me check the capillary refill. Right here. Okay, it fills within 3 seconds, so the capillary refill on his hand is adequate. I'm just gonna remove your sock. Okay. On both of the socks. Okay. I'm also gonna check the capillary refill on the toes. It's adequate. Comes back within 3 seconds. Now, I'm just gonna check all the arteries. I've already did the carotid. Brachial artery seems to be 2+. Good job. Okay. Now, I'm going to check the posterior tibia. Okay. And I'm going to also check it in line with both of the sides to make sure that they are actually corresponding. Okay? Check the dorsalis base. Okay? I'll give it about a 2+ for the beats. Okay? Now when I was checking and palpating the legs and the lower extremities, the upper extremities, I also was looking for signs of edema, and from the palpating of the extremities, no edema was present. Okay? Alright, Corey, let me get you to sit up. Okay? Are you comfortable right now? Okay. I pretty much think that is it for the assessment. I told you I won't keep you here long. You are a very great patient. Is there anything that I can get for you at this time that you need from me?
Nah, that's all. I just appreciate you.
Okay, so here's your call light.
Okay.
You can put your socks and shoes and everything back on, and then the doctor will be in here to see you shortly.
Okay, thank you, sir.
Okay, have a great day.
All right, you too.